by Dr. Jenny Harries. Before I talk about the latest steps we're taking to defeat the coronavirus, let me update you on the latest information from the COBRA data file. I can report, through the government's monitoring and testing programme, that as of today, 612,031 tests for coronavirus have now been carried out in the UK, including 28,532 tests yesterday. 143,464 people have tested positive. That's an increase of 5,386 cases since yesterday. 17,049 people are currently in hospital with coronavirus in the UK. That's down from 17,615 the day before and down 10% on the same day last week. And sadly, of those in hospital with the virus, 19,506 have now died. That's an increase of 684 fatalities since yesterday. We express our condolences to their families, their friends. We must not forget that each of these statistics represents a personal tragedy. Despite the continued challenges ahead, as we prepare for the next stage in our battle to beat this pandemic, there are tentative signs we are making progress. The main reason is the way Britain has responded to the guidance to stay at home and maintain social distancing over the past few weeks. By respecting these measures, the whole country is slowing the spread of the virus. By avoiding public transport, we're freeing up space for critical workers who rely on buses and trains to travel safely. The continued cooperation of both operations of both passenger and freight transport is critically important to our resilience as a country. So today, I'm announcing a new package of measures to ensure transport boosts our national response to COVID-19. First, we're announcing a far-reaching package to safeguard the flow of essential goods into and across our country. I can announce the government has secured a trilateral agreement along with French and Irish governments, which commits our nations to keeping freight routes open throughout this crisis, bringing in life-saving medicines, food, and many other essential goods, allowing us time to meet the needs of our countries during this difficult period. Operators on many of these routes have been under rising financial pressure due to falling demand. Since many of them bring in crucial goods like medicines, raw materials, and chemicals to purify water, it is important to guarantee the continuation of these services. So we're protecting ferry routes between Great Britain and Northern Ireland with funding of up to £17 million. We're also taking action to secure services around the United Kingdom, including £10.5 million for links to the Isle of Wight and the Scilly Isles, allowing critical freight to continue to support families to every part of our country. And we're making sure that air links to Belfast and Derry, Londonderry and Northern Ireland will continue so that these routes are particularly important for critical workers. Thanks to the measures I've announced today, we are also safeguarding 5 ferry and 2 air routes between Great Britain and Northern Ireland, and 26 different freight routes from Britain and between Britain and France, Belgium, Spain, the Netherlands, Denmark, Germany, Norway, and Sweden. Second, we have launched a transport support unit dedicated to fighting this pandemic. At the beginning of the crisis, we reduced services like rail and buses while securing their continuation to enable critical workers could make their way on essential journeys. Lower riderships means we have spare capacity, which I have directed to be used for logistical tasks to fight this virus. By making use of the people and the resources of the Department of Transport and its agencies and arm's-length bodies, we've been able to help NHS trusts and local resilience groups fight this pandemic. We now have over 8,500 specialist volunteers from across the transport sector and around 9,000 vehicles which can support the national effort. This includes 4 fixed-wing aircraft owned by the Maritime and Coast Guard Agency, one of them a 737, helicopters, ships and trains. Together, they will help move emergency patients and medical supplies, deliver PPE to hospitals and distribute food parcels to vulnerable people. Meanwhile, vehicles from Highways England will act as mobile COVID-19 testing centres. Network Rail is also making available its 7 regional distribution centres, which can be used to support that effort. And this work is now underway, and I'd like to thank all those taking part, like the Network Rail engineers who helped fit out the Nightingale Hospital in Manchester. As the country works hard to beat this virus, it is vital we come together and we help each other. So the Transport Support Unit is getting to work, helping frontline staff and making full use of the significant resources at its disposal. I've also given the green light to trials of drones to deliver medical supplies. Earlier this year, we awarded £28 million to Southampton and Portsmouth to deliver a future transport zone. As part of that initiative, £8 million was earmarked for testing drones and how they might be used to deliver goods in the years and decades ahead. Of course, now we have an urgent need, so we're making use of that testing programme as part of our response to COVID-19. As a result, I fast-tracked trials to begin next week to carry medical supplies and equipment to St Mary's Hospital near Newport on the Isle of Wight. Finally, we've made funding available today to keep England's trams operating. This will help in the fight to keep light rail networks in Greater Manchester, Sheffield, Nottingham, West Midlands and Tyne of Wear operating, allowing essential local routes to remain open and key workers to get to work during this crisis. All of these new initiatives build on the very considerable work we've seen across transport since this crisis began. The government's taken widespread action to support the industry. For example, we stepped in to keep trains running and to keep the buses running. We've worked with the Foreign and Commonwealth Office and airlines to bring thousands of Britons home who are stuck abroad. And as of today, I can also confirm that there are now no British holidaymakers left stranded on cruise ships anywhere in the world. To help motorists, we've waived the MOT renewals until the end of the outbreak, ensuring that vulnerable people are able to stay at home without worrying about their cars. But I want to pay particular tribute to the transport critical workers who've gone above and beyond to keep vital freight and passenger services running, to keep hospitals and chemists supplied with medical goods, to ensure supermarkets are stocked with fresh food, and to maintain deliveries of essential energy and food supplies. From hauliers and train drivers to those keeping our ports and airports open, each and every one of us depends on the transport lifeline that they provide. And they, of course, are part of an army of critical workers helping to fight this terrible scourge. But before we can consider if it's safe to amend these restrictions, we must first satisfy we have met the 5 tests set out by the First Secretary to ensure that the NHS can continue to cope, that the daily death rates fall sustainably and consistently, that the rate of infection is falling, that operational challenges have been met, and most importantly, that there is no risk of a second peak. Now, we don't know yet when that day will come, but I do know that that day will arrive sooner if motorists and others continue to only make essential journeys. The actions I've announced today will ensure that the transport can continue to serve the nation during this crisis, keep us supplied with everything we need to stay at home, yet also ensure that infrastructure required to emerge from this pandemic stands ready to serve us all when that time does arrive. I'd like to turn to Dr. Jenny Harris.
Thank you. So just to evidence how hard I think we've all been working and the results of that work in relation to the 5 key criteria that we're trying to achieve, we have some familiar slides here. And to note, obviously, on the first one, this is highlighting the change in our transport use It was right down to 59% lower than the first week of February. It has risen a little bit, just 2 or 3% in the last week. And I would like to just reinforce how important it is that we retain that success in reducing the amount of contacts that we're having in our travelling, which we know has contributed significantly to supporting the change in transmission of disease. Next slide, please. So the next slide shows the numbers of cases reported. These are when lab tests are completed. That's sometimes a few days after the test itself. And there are two colours on here. And what you'll notice as we go through the slides is, firstly, obviously, that the total number of cases has risen. It represents an epidemic curve of a type, but there is fluctuation relating to the reporting of the tests. But importantly, the curve is flattening, which I think indicates the reduction in cases and transmissions. But just with a little caveat as we go forward, with the increased numbers of tests available, and that's particularly in Pillar 2, that's the orange colour on the slide, we will expect to see, in some ways, an increase in cases because we're having an increase in detection numbers. So this is a good signal. We are flattening that curve. It rose sharply and it's levelled off. But don't be surprised if cases do increase a bit as our actual testing increases as well. Next slide, please. So this slide demonstrates the people in hospital with confirmed COVID-19, and this has fallen obviously very markedly in London. We can see how hard the NHS was working, particularly in the first week in April, and the success that that's had. And in fact, I think on the number of inpatients who've been diagnosed with COVID in the last 24 hours, for the first time in many, many weeks, this has fallen below 1,000. So this is real success, and many other success stories, as you can see, with many areas working really hard. But we do need to keep our social distancing measures going. We must not allow those peaks to start curving upwards again. Next slide, please. And again, critical care bed use, we can see a sharp rise. I know there were concerns in members of the public about whether our capacity would be sufficient. It has always been sufficient, and increasingly on a day-to-day basis as we manage the disease and the epidemic in the UK, the numbers of beds available has significantly risen. So there is a lot of hard work, of course, on the front line, and we mustn't underestimate that by NHS colleagues, but capacity is continuing to increase as we move forward. Next slide, please. And then, sadly, of course, we report the deaths which happen. These are deaths which are confirmed in hospital. They're not reported until all the paperwork is cleared. So again, you will see some variation in the reporting, but generally an increase in deaths as the epidemic spread, and then very gradually but subtly an overall decline, a trend in downward death data. Next slide, please. And then finally, this tries to give an indication. It's very difficult because of the difficult comparisons of death data between countries, but to indicate how the UK is doing in relation to other parts of the world. The far right blue death line, which you can see marked as UK hospitals only, indicates the data that we've just seen on the preceding slide. And then increasingly we are trying to provide a much broader indication to ensure that we're capturing deaths which are not just in hospital, but that we know will be happening in communities, to make sure that we're clear how we are managing the disease and to make sure that we are looking after those who are most vulnerable. Thank you.
Thank you very much, Jenny. I'd like to turn now to Hugh Pym, the BBC. Hugh.
Thank you. Online booking for virus testing has clearly proved very popular. Thousands of workers got the slots they wanted or managed to book kits. Others may well have been disappointed. What assurances can you give about future demand being met? And how much will capacity go up over the next few days?
Hugh, thanks very much. I can tell you actually that there were reports that the website had crashed, which it hadn't. It was simply that the slots for today were taken up. We've seen, haven't we, in the last few days, this difference between the capacity available, I think the last figure I saw was 51,000, and the number of tests done, 28,000 yesterday, and how important it is to make sure we're using that available capacity. People being able to book online directly, that's all the critical workers, 10.72 million people with their families, are those who are available now to use that site. I can tell you also that 16,000 of those were booked during the first period of that being online. And the site has actually been brought back up around now for more people to go and book sites. It will then close off again. More tests will become available tomorrow, and so on. So the answer is, as we heard from Professor Newton standing here yesterday, it looks like the trajectory to 100,000 tests by the end of April is going to be met in terms of capacity. I would say after the experience today, it looks like the demand is there, and if those two things come together, of course, then we will have that 100,000 tests per day ambition met. So that's the status of the situation. One more thing to add is that we have heard from the devolved administrations who also now want to join in using that online booking system as well. Did you want to come back, Hugh?
No, just to say, obviously, you don't want people's expectations to be disappointed. Just to sum up, are you pretty confident that you can meet the demand that is out there, certainly in the next week or so?
I think it's fair to say that so no one, of course, quite knows. But we know what the capacity is. We don't quite know how many people would want to be tested because many people working for the NHS, for example, will have already accessed those tests through their workplaces. This is now a much wider number of people, key workers, critical workers, including, for example, the transport workers that I was talking about in my comments, and we don't know the answer to how many that will be. I do know, and it is worth stressing to people when they go to that site, that this is a test which will only test if you currently have coronavirus. So there's no point to go on there and test to see if you had it 3 weeks ago. It's not going to give you the answer to that question. So it's a current day thing. We'll see how it settles down, but we're encouraged by those 16,000 bookings online. Indeed, 46,000 people went to the portal first thing today. There's some more slots opening up right now as I'm speaking, and there'll be more slots tomorrow and days after. I don't know if there's anything you wanted to add, Jenny, or that may well cover it all. Thank you very much, Hugh. I'll turn to Roger Johnson, BBC North West. Roger.
Secretary of State, thank you very much. I'll ask one in a moment, if I may, about light rail systems, which you talked about. But talking about social distancing, the sun has been shining in the Northwest, as in a lot of places, for a couple of weeks now, which in this part of the world is an achievement. I had a conversation today with a lady called Jo, whose sister was a healthcare worker who worked in a hospital in South Manchester. She died of COVID-19. It was her funeral today. She was in tears on the phone when I spoke to her, when she talked about the number of people who were out on the streets as they drove back from the funeral, not practicing social distancing. And I wonder, as the police forces here say that it is becoming an increasing problem, whether it is possible to manage people's expectations about how much longer the lockdown will go on, and perhaps, if necessary, to encourage the police, rather than to police by consent, to go back to a different way of policing as they did at the beginning. I wonder what your thoughts were.
Look, I think overall, I mean, it's tragic to hear stories like that. And I think overall, the country's done incredibly well in adhering to social distancing. And there is a danger as we go into yet another warm, sunny weekend that people think that perhaps these graphs are showing that, the peak is over. But as Jenny was very clearly showing, and I'll ask her to comment in a moment, it isn't over. We're riding perhaps we hope a downward trend, but it's by no means established yet. And when people ask me, when will the measures, the social distancing, the stay-at-home measures be altered, my answer in some ways is some of this lies in your own hands. The more we adhere to it and are strict about the social distancing that's required, the faster that decision will be able to be made. But that decision, of course, will be made entirely on the advice of science and medical advice. Jenny, can I turn to you?
Yes. So I think, the story you provide is often a very powerful one. People who have lost relatives or loved ones or colleagues at work really feel when they see people flouting the social distancing requirements. And it is absolutely critical that we maintain them. It does, of course, demonstrate why, although this is a very science-led approach, that science includes behavioural science. And right at the start of the advice that was given, there was a considerable amount of debate and discussion and evidence looked at relating to how people comply with social distancing. And these are very difficult things to get the balance right. On the whole, as we've just seen, most of the public are really complying and really supporting. That becomes increasingly difficult as we go through. But actually just pretending that we can jump out of it easily is not the answer at all. We will lose all the benefit of the hard work that we've done if we lift that. So I think absolutely we need to encourage everybody to comply and perhaps just keep explaining. We perhaps sound a little monotonous sometimes, but really important. So even the basic things that we started with, washing hands frequently when you've been out, when you come in, before you have your food, and keeping 2 metres away from other people are absolutely critical.
And Roger, you mentioned you wanted to come in on light rail as well, I think.
Yes, thank you very much. It's just a quick question for you, really. 95% down passenger numbers on the Manchester Metro link. And Andy Burnham, the Greater Manchester Mayor, said it was within days of having to be mothballed, but clearly it's crucial for key workers to get to work. So therefore, government support to keep it running is welcome. I just wondered how soon that money will come through and what form it will take.
So I've been in contact with Andy Burnham and other mayors in the last few days and indeed throughout the whole of this crisis. And we absolutely agree that support is required. And in this package today, which would be substantial, assistance will be provided. I think it's fair to say, though, we're not looking to try to run services. As you say, 95% of people aren't travelling. We're not looking to run the full service whilst this is ongoing. But it is very important that they're available, not least to get those critical workers to the NHS and around, as discussed. So we're pretty much there, and no doubt I'll be speaking to the mayors and others this coming weekend about it as well. Thank you very much indeed. Can I turn to Heather Edwards, ITV Meridian?
Good afternoon. To the Secretary of State, please. You've just announced there's £10.5 million of government money to keep these essential ferry services running between the mainland and the Isle of Wight and the Isles of Scilly. But we do know of other ferry companies that are struggling because of this lockdown. Notably, at the Port of Dover, P&O Ferries says it urgently needs £150 million of government money if it's going to stay afloat. Of course, they're currently bringing in food and medicines to the UK. Will they also get government funding? And secondly, if I could just say, we believe about 15,000 people a day are still flying into UK airports from overseas. None are being checked for COVID. We now have the Chief Executive of Heathrow Airport personally appealing to you and the Health Secretary to screen passengers as they come in. Why is this currently not being done?
Thanks very much, Heather. I referred in my speech to a trilateral agreement that we've reached with the French and the Republic of Ireland government, which is about that critical freight flow to which you refer, P&O, Stena and others. And in my remarks, I also made reference to 26 different freight routes from Britain, France, Belgium, many other countries, I won't repeat the list, which have been secured as well. That is in addition to those freight services and transport services which have been secured to places like the Isle of Wight and also the links from Great Britain to Northern Ireland. So all of those things are included in the package and will ensure that a minimum level of service is provided so people can go to the shops and be confident that the goods are back on the shelves and remain there as they are now throughout the rest of this crisis. Look, with regards to flights, it is the case that, of course, people have been able to fly here. The numbers are down massively. There's probably only 4 or 5% of the flights that were taking place before this crisis, and the load factors are very low. Quite a lot of the people returning, 1.3 million of them, I think, so far, have been British nationals abroad who wouldn't have been able to come back had it not been for those flights. The requirements for anyone coming to this country at the moment are to stay in one place and not leave for any reasons. And as we come out of, or any of the reasons outside of the four stated, as we come out of this and into the next phase at a future point, we will continue to keep the excellent medical scientific advice we receive under review to say whether those procedures at airports should change. But I do just want to make this point. Countries that lock down the flights, I'm thinking, for example, in the United States, who prevented Brits from flying there or Europeans from flying there, other countries, have not necessarily weathered the storm of the coronavirus any better, and many of them have seen much higher levels of deaths. So although it should and must be part of the plan going forward, I think it's probably more useful during the phase of test, track and trace that the Health Secretary was talking about yesterday. Jenny, I think that's probably correct.
Yes, very happy to. I mean, this country and many others learned a lot actually from the West African Ebola outbreak, and there's been considerable discussion since then. And there are periods when elements of screening, and I use that word advisedly because it means very different things to different people, can be very reassuring to the public and can be helpful. So, for example, if you have a country which has a very high rate of an illness like Ebola, an exit screening programme to prevent people leaving the area and dispersing across the world can be helpful. And certainly early in this particular pandemic, of course, you'll be aware that we very closely quarantined people, for example, coming back from Wuhan and the very high-risk areas. Once the prevalence of disease balances, if you like, across the world, that becomes a less effective mechanism. And as the Minister said, what may well become an opportunity is when our rates are very tightly controlled and individuals are coming into the country. Even then, it's not quite as simple. So I think often an average traveller will be very reassured with a sort of thermometer scanning gun. But if I said to you, if you look at the detail of those, that the variation in reliability of their temperature control and recording can be 2 or 3 degrees, plus or minus, and it may depend on the ambient temperature or even the colour around that scanning unit, you can see that it's quite problematic in saying whether an individual should be pulled in or out for screening. Equally, people can we're relying on them often to provide their own story. And I think the most critical point is when somebody comes through a port of entry, they may be there going through 2 or 3 minutes. An incubation period for this disease, I think, runs into about 21,500 minutes. So the likelihood of sort of grabbing somebody at that point is quite small. But there are important considerations for doing that, and I know that government is looking at those.
Thank you very much, Heather. Can I turn to Dan Hewitt of ITV?
Hello, good afternoon to both of you. Given that you've promised 10 million key workers and their families who are showing symptoms a coronavirus test, do you accept that you raised expectations way beyond anything you can deliver, considering you only have orders for 5,000 home testing kits and 15,000 drive-through appointments? Do you regret raising expectations as high as you have? And given that right now on the government website there's no eligibility tests to prove that you're a key worker, you're effectively trusting anyone who goes on that website to book an appointment for a test or book a home kit without any checks on who they actually are. Will you at some point consider changing that, bringing in checks if the numbers continue to be so high?
Thank you. Look, we'll always keep this under review, and particularly the operation of that website. But I think it is true to say that it's although there are, as you say, 10 million or 10.72 million is the actual figure, key workers and families, or households, I should say more accurately, who are eligible. As I stressed before, there's actually no point taking a test, I think, from a medical point of view. I'd defer to Jenny on this, unless you think you have some symptoms, unless you have a reason to be taking it, and particularly no point in taking a test if you already had it 3 weeks ago, or you suspected you did. You've probably missed the boat, I think. But look, in terms of expectation management and the rest of it, the Health Secretary stood here, made a very clear pledge at the beginning of the month. A lot of people thought it would be difficult to achieve, to get to 100,000. We can see capacity has been rising very fast, then people quite rightly said, well, what about the demand for these tests? You're not just getting through enough of them. The fact that people now want those tests, now we've made it much easier to obtain them, I think is a good thing. And I think it's helpful, and we will have to see in the coming days how we balance that demand with the availability of tests. But I think I'm right in saying that everyone would welcome us getting to the 100,000 figure, and it would be very good to see that demand match with the capacity, which has increasingly been coming available. Jenny?
Yes, I was just wanted to reinforce the point that you made about this is the have you got it now test, and it will be a wasted test if people track online, take one of those tests up and to find it's a negative. What we really want to do is encourage those who have symptoms to take the test, or where somebody in their family does. And if those do prove negative, with a certain number of caveats which are outlined, then it does mean that those people can be back at work and their families can be out circulating within the social distancing rules as normal. So it is important that the public use these tests in the way that they were intended, because that will benefit all of us, but particularly our frontline services.
Dan, you look like you might want to come back.
Well, only to say that we're talking here about key workers, many of whom do shift work. So if you're opening the website up at 8 o'clock in the morning, many of them can't sit at home with their computer hitting refresh like they're trying to buy tickets for a festival. It's not that simple. So is there a system you can come up with that means that there isn't this rush every single morning for these people who aren't necessarily going to be at home able to do that?
Yeah. Well, look, actually, I think one of the things I should mention is yesterday one of the slides showed there were 27 drive-through sites. I can tell you today there are now 31 regional drive-through sites. So we're making it easier by having more of these for people to be able to get to them quicker. I think by the end of next week, I think it is, we're aiming to increase that number quite a lot again. So I think to 48. I think the point is we want to make it as easy as possible. We do have a smaller number at the moment, but it's in trial, as it were, of home tests picked up by courier afterwards to be tested. And hopefully we'll be able to expand that programme as well. But I think that if by the end of next week, the end of the month, we've got somewhere near that goal of 100,000, I think in comparative terms, internationally, that's actually a very high number, and Jenny may have more knowledge on that.
I just wanted to point out a sort of very obvious clinical feature, which is I recognise there's a challenge about the process, but of course, if you are symptomatic and you're a critical worker, you should not be at work. You should be at home. You may not feel quite well enough to be hitting a button on a computer, but please do not be at work if you're symptomatic and needing a test.
That's a very good point. Of course, you shouldn't be there in the first place. That's true. But look, I think we have to sort of be sensible about this. Everybody recognises that this is building a test system from scratch. Everyone knows it's an enormous challenge, and I think the NHS and many of the outside organisations who've been involved in this have really been rising to the challenge, and it looks like meeting those numbers will be possible, and hopefully balancing both the demand and the capacity for those tests as well in the coming days. Thank you very much, Dan. Can I turn to Annabelle Dixon, Politico?
Thank you, Secretary of State. First question for you. The latest round of Brexit talks finished today with both sides admitting that limited progress was made. Senior figures in a key sector for your department, the haulage sector, have warned that the coronavirus outbreak means they're simply not in a position to give the complexity of future trade arrangements with the EU the necessary focus, and they believe the transition period should be extended. Are they wrong? And a question for Dr. Harries as well. We saw today the huge demand for home testing kits from key workers who are now able to apply. Anyone who's watched a coronavirus test being administered can see it's not a simple task. Are you confident that these tests will be reliable? And do you know what the failure rate is for these self-administered tests?
Annabelle, thank you very much. I'll take the first point about the Brexit talks, and people may not be aware that these have been continuing during this period, and they take place via video. And as you rightly say, the latest round has just taken place. But actually, included some very good progress on some areas. For example, energy, transport, civil nuclear, all made significant progress. And transport is one of the areas where actually there isn't necessarily quite so much distance between us. But look, it is true to say, and you will have heard all this before, this country not only voted to leave the EU, though I actually didn't in that referendum, but the country nonetheless did. But we've also had a general election since, which a lot of people voted for the manifesto, saying that this is exactly what we were going to do, and that we weren't going to entertain an extension to the transition period, and that remains the case. We think the best way of providing certainty to all businesses out there is to know that we're not going to keep chopping and changing, that the transition period will end at the end of the year, to carry on these negotiations with the EU in good faith, along with negotiations with other countries in the world, and at least then to be able to provide the certainty. And I keep very close contact with the haulage industry, who, as you rightly say, are right on the front line during this crisis. And as I described in the freight package that I outlined today, to which the government is also providing significant assistance. But no, we won't be extending to answer your question. Jenny, on demand for testing kits.
So I think the underlying question was around the reliability of them, and obviously tests can fail, if you like, for a number of reasons. The test may not be sensitive enough, it may not be specific enough. You can have problems, which we perhaps often hear about in vaccinations, for example, where things are not stored properly in chains. So it's quite difficult to actually try and put any sort of number on the failure element, I think, which is what you're describing, of potentially somebody taking the test themselves. But what I can assure you is we have done in piloting these tests, run tests in parallel. So having a trained worker take a test and then an individual who's not trained take them. And actually, they're remarkably comparable for this. We wouldn't be launching something if it wasn't. I think, having said that, where we have some other testing, so for example, you will have heard about the ONS survey, that it's important we understand the prevalence of disease. We need to extrapolate data from that, make sure we understand as far as we can what the prevalence of diseases across the country. Where we want it to be absolutely robust, then we will try and use exactly the same techniques and trained individuals so they are directly comparable. And I think there are other settings where it actually can be quite an unpleasant thing to do, and it may not be very normal. So, for example, in a care home where it's really important that we are looking after both our care workers and our residents, there's likely to be additional training there, because we need to ensure that those tests are taken appropriately and we get good answers. There is actually a video that goes alongside this programme so people can see how they should do it. But we did try that and it came out comparable.
That's hugely helpful to know, Jenny. Thank you. Annabelle, do you want to come back on Brexit or testing kits?
Yeah, I just wanted to come back on one more thing. Many people in the UK will have seen the clip overnight of the President of the United States suggesting coronavirus might be treated by injecting disinfectant into the body. Do you have a message to Donald Trump about the dangers of spreading dangerous disinformation when governments around the world are trying to combat its spread from other sources?
I think here I'll defer to medical expertise. Jenny.
So I wouldn't have a specific message to Donald Trump. I'd have a specific message to anybody who suggested they should be injecting anything into their bodies. Clearly, we would not support, from a medical professional perspective, it is really important that people use appropriate treatments that are evidence-based and tested. We have very good programmes that have been taken up very rapidly, coordinated in this country, testing various different alternative treatments. Those trials will report reasonably early, but certainly nobody should be injecting anything, and we should be using evidence-based and properly trialled treatments that we know will be safe.
Perfectly clear. Thank you very much indeed. Thank you, Annabelle. John Walker from Birmingham Live and the Newcastle Chronicle.
Secretary of State, I'd like to raise again the issue of light rail systems, which, as you'll know, are playing a vital role in major cities getting key workers to work. You said that the Department for Transport will support them, but I don't think you've given any indication how much funding they can expect. So, for example, Tyne and Wear say they need a £10 million bailout just to keep the metro running until July. Manchester says their Metrolink is losing millions of pounds a month, and Transport for the West Midlands says that their metro is losing at least £1 million a month and could be forced to close. Can you tell me how much funding these regions can expect? Secondly, if I may, a question for Jenny Harris. Do we know why people from some ethnic minority backgrounds seem to be dying in disproportionately high numbers during this crisis? Or if we don't know at this stage, perhaps could you tell us what sort of work is taking place to try to find out?
Thanks very much, John. To answer your question, no, I don't have the actual figure for you, and that's because we're still in discussions with the various different systems, and also discussing the level to which that they should be continuing to provide service, and also other assistance that they're able to access. This is a package which runs into the millions. It's not a small endeavour to do this, and I mentioned the particular systems to which it will apply. More details soon. But I also want to say that we heard, actually, I think in a comment earlier, these systems are running way below ordinary capacity, and quite rightly, because people are following the social distancing, please don't go out unless you need to, instructions. So it is a case of finding a route with them which allows them to remain viable entities, but not continue to run exactly the same service that they run at the moment. But we're actively in touch with them, and I think it's good news today that we've announced there is going to be a multi-million-pound package to ensure that those light rail systems, which are excellent in all cases, can continue. Jenny.
Thank you. So this is a hugely important and hugely complex subject, so you actually may wish to stop me if I get into full flow. It's really important when we look at disease prevalence and severity, and particularly which individuals are losing their lives. We always look at different characteristics, whether that be gender, whether it be age, or in this case our focus is on black and minority ethnic groups, and trying to untangle all of the different elements that might indicate that there was an excess of severe disease, an excess of catching the disease in the first place, or even more importantly, those people who die from the disease, is very complex. And if I just give a few examples, number one, our data has to be very, very good, and even the recording of ethnicity, both by a country of origin, for example, or an ethnic group which somebody feels part of, that is hugely complex. So a death certificate will give the country of origin, but that may well not give anything to do with how the individual has lived their lives, or the community that they've lived in, or the sorts of exposures to disease that they may have. So there is a huge amount of work ongoing on this. As soon as there was an issue potentially identified, and I say potentially because I think we need to wait until we have very, very clear data. There was a meeting of senior clinical professionals, and Public Health England announced, or it was announced a couple of days ago, Public Health England will be doing a very detailed review into this. The sorts of things that need to be looked at, and I know will be, it's not just as simple as the ethnic position, but it will be things like, for example, what other conditions we know that individuals from particular ethnic backgrounds suffer from. So hypertension, high blood pressure, is something which we know carries an increased risk of severe disease and poor outcomes in COVID, and that is also more prevalent in some ethnic minorities. So it's actually untangling this. I think the other things, though, are there some very important things. It's not just the underlying conditions, it's also about how people live their lives. So this disease will transmit more. We're all taking social distancing measures if we're very close together. So people who live in close communities may well have poorer outcomes, or more likely to transmit disease. And obviously also many of our black and minority ethnic groups are in different elements of socio-economic status, and that is a really important point that also needs to be considered. I think the final point I'd just make is that actually it's really important that we engage with those communities to understand. And in this country, we have very, very high representation in the NHS, so huge numbers of workers in the NHS and in our frontline care services are from minority ethnic groups, and so we need to understand how they are represented. I know, for example, in healthcare, in the very sad deaths in health workers, it may be that that is proportionate to the very high benefit that they provide to our health service, in the sense they are overrepresented. I think it's about 45% of doctors in the London area, for example, are from minority ethnic groups. So very, very complex. All of those things need to be considered, and they are under very active consideration.
Thank you very much indeed, Jenny. I know it's also true to say that something that Public Health England are also looking into. Lastly, can I turn to Harrison Jones at the Metro, please?
Thanks very much, Grant. The Health Secretary promised 100,000 tests would be carried out daily by the end of the month, before the goalpost was seemingly moved to talk about our capacity for testing. We hit less than 29,000 tests today. When will we reach the Prime Minister's previous target of 250,000? And how and when will testing be opened up beyond key workers and their families? And if I may, just an extra question on contact tracing and the new NHS app. Are we expecting to follow a similar model to South Korea, which involves public's movements being tracked via a mobile phone GPS signal?
Thanks very much, Harrison. So, look, on the 100,000, and this is the number of tests versus the capacity, and it's a well-worn discussion. I think what we've been finding is the capacity has been rising pretty fast. As I mentioned, Professor Newton just yesterday says that he thinks we're going to get to that 100,000 ambition by the end of the month. I think we can see that because the additional testing facilities are coming online, and these are sort of super labs, and they're starting to look at the automation of those to make them even faster. The problem has been that there haven't been sufficient people being tested coming forward through the route, which is quite convoluted, of course, of somebody having to go through their employer, perhaps the NHS or a care home, in order to take that test. What we've seen today is there is excess demand for tests out there, and I can therefore confidently say, adding the two figures that you mentioned, the 28,000 who were tested yesterday through the ordinary system and the 16,000 or so that I mentioned today, that the numbers are going to be rising pretty sharply and quite fast. So I think that all backs what was said yesterday, that the number of tests as well as the capacity, so the tests as well, look like they are all headed in the right direction, and we look forward to seeing that. I think the Prime Minister mentioned 250,000 as an ambition without a particular timetable. The important thing, which leads into your second question, is why we're doing this, and the contact testing, tracing is absolutely vital to it. My understanding of the technology is that the app uses a sort of Bluetooth signal to completely anonymously be able to check who's been within a Bluetooth range and then use that as part of the contact tracing follow-up. I think that's the correct technical explanation on it. Jenny may have something to add, and I think you want to come back in, Harrison.
Shall I just add a little bit to that? So I think the ambition, as you say, is to digitalise some of this process, to try and support measures that can bring us back out of some of the social distancing restrictions. Clearly, I'm sure we only have to look at our own families to think how many, usually the younger generation, have got the right sort of mobile phones and would be quite happily working that way. And as you work up the years, grandparents and things who perhaps don't. So having a single model around track and trace is not going to be possible. It will require a certain proportion of us to be using those phones. It will require very rapid testing of the key individual and very strict compliance of all of those who are triggered, if you like, who said you've been near somebody who may have symptoms of coronavirus, to take appropriate action. So I think there's quite a lot of work to keep going on that, and we are likely to have some sort of hybrid response in order to manage both the digital side and human nature. But exactly heading in the right direction, and obviously the testing in that scenario will be really important.
We heard yesterday about the 18,000 contact tracing people. I think it's also true to say you require quite high take-up of the app to make it useful, and this will be another great national effort required. It will be an NHS app, and I know that how people feel about supporting our NHS. This will be a new way to show support for it when that's available. And finally, I'll just come back to you, Harrison.
Thanks. Yeah, just on the 250,000 target, Boris Johnson talks about it on the 25th of March. Do you have a date for when that 250,000 target is going to be reached, or is it just going to stay as an ambition?
I think it was an ambition from the Prime Minister, and actually I think the fact that we've been able to go from, I recall, I think when the Health Secretary was talking about this, 7,000 tests a day were being carried out on average each day, and it now looks likely we'll get certainly to the 100,000 capacity and quite likely to the testing of 100,000 a day as well, shows what we can achieve. And I do pay huge tribute to the many different organisations who've been involved in getting us there, not just Public Health England, but the private labs, the universities, and the enormous scale-up that's been required to achieve something which looked like a very ambitious, indeed was a very, very ambitious target. Harrison, thank you very much indeed. I just wanted to finish by saying that we're often asked about when this particular phase can come to an end. And in many ways, the answer to that, I think, lies in our own hands. This is going to be another sunny weekend. We know that we've made a lot of great gains that Jenny has been explaining to us in those graphs earlier, of flattening the curve. But it's absolutely essential that we do not let that slip this weekend. And the message, as ever, remains the same, to stay home, protect the NHS, and therefore save lives. Thank you very much indeed. Thank you.